with care. This altered file is dangerous, not just because of the
Yeah,
lies contained in it, but because it is the file that was presented to Nakuru County's health officials, which they have in their records. Unbeknownst to them, it is the false version of events. NTV reached out to the Clinical Officers Council to understand the background of Victor Onsari. In response, they confirmed that he was indeed a registered clinical officer, although it was difficult to establish when he started practicing. During Wycliffe's conversation with the theatre technician on the night Agnes died, she alluded that Victor had administered the incorrect amounts of anesthesia into Agnes before she was operated on, and that the team noticed her condition declining. They then confirmed that she was dead on the operating table. In order to counter-check this, we reached out to Victor. After several attempts, however, we could not get through to him, and later word reached us that he died sometime in August 2025. His family confirmed his demise. They say he died after reaching his house after a night shift at a hospital and died from suffocation in unclear circumstances. They insist he was a professional who never had any complaints formed against him. But while the reports heavily implicate Victor, he was not the only team on duty that night. NTV has managed to identify the full team that was present as Agnes died on the operating table. They were Dr. Charles Kivumbi, an external doctor, was called in to conduct the cesarean section. Victor Onsari, who we now know was the anesthetist. Lydia Auma and Milka Mongari Kwamboka, who are listed as the first and second assistants during the procedure. Milka is also the person Wycliffe was on the phone with earlier. Keep a keen note of Milka Kwamboka as she appears in yet another case in this report. But regarding Agnes, we reached out to her to understand what happened on the night that Agnes died. Naambiwa ulikuwa mmoja wa wale walikuwa wako ndani ya theater wakati alifanya hiyo upasuaji. So nilikuwa nataka kuconfirm kama ulikuwa huko. And if so, kama unaweza nisaidia na details za nini ilifanyika hiyo siku. Mimi ngoja kidogo akaenda tuongee baadaye. Tuongee saa ngapi? Jioni what time? 6:40. Milka never picked up when I called her, but later texted denying that she was present on the night that Agnes died, despite earlier agreeing that she was. We also reached out to the other nursing assistant, Lydia Auma, to understand more about what happened on the night of 21st August 2024 when Agnes died. Yeah, I think it would be nice to be in a Kubo hospital. Nisha launch you, but you see, I'm also talking to you specifically. Do you know the proper ambulance? Yeah, just talk to her. So, are you confirming? Are you denying? No, I'm not. I won't say anything as well. Were you in the ambulance with Agnes when she was dead? Yes, talk to her. I'm asking, were you in the ambulance with Agnes? We also found her TikTok account, which presents the attitude she has towards her work. In one of the posts, she attaches a patient's record. In another shocking post, she mocks mothers who have died after giving birth. And in yet another one, she mocks maternal death audits. I was not there. We then contacted Dr. Charles Kivumbi on why he did not fill out the medical report, which was strictly required of him, among other details about the night in question. Everything was clear. Was Agnes alive when she left the hospital? That's what I'm saying. It's documented. It's a simple question. Was she alive when she left the hospital? Because you were the doctor in charge. Yes, she was. So you're confirming that she was alive according to you as the doctor in charge? So as the doctor in charge, you're confirming that she was alive when she left the hospital? All the circumstances were documented well. But actually you didn't leave them well documented because, like I said, the data notes were written by Victor Onsari, was an anesthetist, like I went referred by you. And number two, it said that she was dead, and then it said that she was referred. So I wonder how you can refer there.
that one is not right. It is an important thing. It's well documented.
We then reached out to the hospital's management on the scene, where we were directed to the sister in charge, named Sister Agnes.
That one I can't give you the real name because now since I'm new, I may not really give you the right information.
So who can I speak to?
Let me call the previous in charge.
Okay, is she around?
No, she's transferred. She's in Tanzania, but her number can still go through.
Could you kindly send me her contact?
Yes, please.
We received no response from her by the time this report went on air, despite writing an email with the questions as a second attempt. Now we can dig into the second part of the plan that was hatched by the hospital. To do that, we will need to set outward from Nakuru County, where Agnes died, and head 124 kilometers northwest to where she was born and raised in Kapkatet, Nandi County. We journeyed in a bid to not only tell the story of who she was to her family, but to retrace Agnes's final steps before she took her last breath. Her sister Mercy Cheritich should know she witnessed those final moments. Mercy is extremely key in this part of the story. She was at work in Nakuru County when the hospital told her Agnes had been admitted. They said Agnes was alive, but that her case had turned into an emergency which needed referral to another facility. They were waiting for her, and she needed to come as fast as possible. Perplexed, she asked them why they were waiting for her. If it was an emergency, shouldn't her sister be rushed to another facility and she would meet them there?
Ni kama nilikuwa na ngoja. It will take time nilienda hadi nyumbani na kurudi. Kurudi nikatake time tena kwenye nilikuwa nafanya kazi. Kuelezea tajiri ni hivi na hivi ndio nitoka. Sasa kutoka kuenda kufika huko ndio nimeambiwa tu niingie kwa ambulance. Ni kama watu walikuwa wanangoja ndio nitoke. After tu kuingia hivi kwa gari ndio nikatoka.
By the time Mercy had arrived, some hours had passed. What she didn't know is that the hospital wanted her there as a witness for the show they were about to put on to avoid liability for Agnes's death.
Na nikajaribu sasa kuuliza maswali. Nilijaribu kuuliza maswali, ikawa akubariki. Nimejaribu kumuita mara kadhaa. Hakuna response yoyote na mtu anakaa ni kama hayuko sawa. Najaribu kuuliza madaktari wananiambia muache atulie, ni kama amechoka. Sasa nimejaribu kunyamaza, nijaribu hata kumfungua, ndio alikuwa ameniambia nijaribu kutoa nini wakanikataza. Kuuliza nurse akaniambia kuna dawa alidungwa na bado iko kwa mwili inatumika.
Several members of the hospital staff, including Lydia Alma, the nurse, crammed into the ambulance and created a well-rehearsed narrative by telling Mercy that her sister was asleep, when in reality, they had put Mercy next to the corpse of her sister. Something else piqued her attention.
After kuingia kwa ambulance, nikauliza mtoto wako wapi, nikaambiwa mabaki na mama na madailo. Sasa hiyo ndio nikajiuliza, mbona mama angeenda na mtoto, ndio mama akiamka at least wakuwe na mtoto wake. Na hapo sasa niliona there is something going on.
What they did next truly illustrates the lengths they went to in order to lie to her.
Ikafika tu mahali tumeenda mahali hadi ilikuwa sasa. Ndio wakasema tu condition imebadilika. Sasa nimejaribu kumshika huyo daktari kumuuliza condition imebadilika aje, na from the fact tumetoka tu wakiwa hivi. Hivyo tu ndio wakatoka wakaniacha kwa ambulance ndani na sitani. Na wakaenda wakaongea hivi, ndio wakaniambia Agnes amepata.
Mercy says she found the hospital's behavior strange, waiting for her to arrive despite them saying her sister's case was an emergency. The staff inside the ambulance saying Agnes was asleep, yet she was unresponsive and cold to the touch, and how they suddenly stopped along the way and said Agnes's condition had changed, yet she had remained in the same condition since they started the journey. Despite her suspicions, Never in her wildest thoughts did she think that a plan this dark would be orchestrated. Agnes's uncle, Kikurui Kemboi, spent the last few months with Agnes here at the family home. He fondly called her Bangu.
We still have that stuff, crying for help. Ndio sisi pia tuweze kujua ni kwa nini aliana. Si tuliambiwa aliana, tulitaka kufuatilia kujua kwa nini aliana. Hatuna pia picha yenye inaonyesha kwamba aliana kwa sababu ya hii na hii na hii. Yule mtu mwenye amekufa ako na rights zake, na yule mtu mwenye alikuwa na yeye ako na rights zake. Mpaka wakati mnamuita dada yake akuje, eti akuje ampeleke. Mbona mkamuita wakati ambao mnaua?
After the staff staged their show to Mercy, they believed that the cover-up was successful, but they let a few things slip, such as when they told Mercy this.
Kuuliza Mars akaniambia kuna dawa alidungwa na bado iko kwa mwili inatumika.
This lends credence once again to the conversation between Wycliffe and the theatre technician, who claimed Onsari was unable to wake Agnes up after injecting her with the anesthesia. It would also explain why it was Onsari, the anesthetist, who took several measures to conceal the facts he entered in the final report. But the buck did not stop with him. NTV has managed to obtain evidence that shows that the management led by this woman, identified as Sister Redemptor, also took measures in altering the truth. This is a recorded conversation of her talking to Ansari on the phone about the report. This is why the time Wycliffe received a call from the theatre technician is important. It reveals that Agnes died at roughly 6:45 p.m., yet Sister Redemptor wanted to alter this and instead indicate the time of death as 9:30 p.m. They reportedly did this to conceal that Agnes had died at Sister Mazzoli Hospital in order to avoid liability.
So we asked them, why did you refuse to refer this matter? And one of the nurses said, and we have that recording, that you cannot refer a dead body.
While Agnes spent majority of her pregnancy here in Nandi County, she opted to travel to Nakuru County to deliver her child because it was closer to her husband who was working there. But the reason she chose Sister Mazzoli Hospital was because it aligned with her Christian faith.
Kila kitu ikimsumbua anasema hakuna kitu tunaweza fanya, lakini ni kuwa tu na uvumilivu.
Dunia inasema kwamba jua ukweli na ukweli utakuweka huru. Sasa leo wacha Mazzoli Hospital msikie ukweli kutoka kwetu, kwamba nyinyi ni watu ambao mmejificha kwenye kanisa, lakini nyinyi kuna kitu mnajua kuhusu kanisa. Na sisi tumesema bila kitu. You need to tell the truth.
This was the most difficult interview we held. Until the moment we visited Agnes's family, they had no idea that the hospital created this smoke campaign in Agnes's death. Off camera, Mercy wept at hearing what really happened.
Na mimi my sister juu alikuwa mtu anapenda kuuliza juu most of the time hiyo time alikuwa akiwa na bori, alikuwa anapenda kuuliza story ya nyumbani, nauliza kuhusu mnaendelea aje, na mtu alikuwa anapenda kupea mtu advice. What I miss sana ni that company alikuwa very close na mimi. Anything kenye alikuwa anapitia alikuwa ananiambia, na yeye alikuwa tu anapenda kusema tuombeane.
But the question we did not get a clear answer to is why. Why would the hospital go through all these gross extremes to cover up their tracks? The reason may be linked to another case we will explore, of yet another expectant mother who died under similar tragic circumstances in the hospital's hands. The grief caused by Agnes's death is worn on her family's sleeve. Her husband, who is now raising the child he and Agnes were meant to raise together, cradles their fond memories close. We noted snippets of his pain via his social media pages. For privacy reasons, he opted not to speak to us on camera.
Brody, I give it all up. But just one more day with her.
This next chapter of our investigation makes it more apparent that the misconduct at the hospital was not linear, but in fact, a deeply embedded matrix of fraud that left its grooves and prints in virtually everything, with patients ultimately doused in the neglect that the hospital peddled. This is Justice. He asked us to hide his identity, a decision whose reason will become apparent shortly. This is a message that NTV has managed to obtain. It indicates that Justice underwent a thyroidectomy surgery, which cost 134,400 shillings under the Social Health Authority. The surgery was authorized and the money was dispatched to Sister Mazzoldi Hospital. Except that Justice's thyroid is intact. The surgery was never conducted and he was never a patient at Sister Mazzoldi Hospital, because at the time, he was in fact an employee of the hospital.
It was back in February. A colleague approached me that there is a change that is going on, that employee, they are asked to produce their details, ID number, so that they be registered for SHA, that a procedure is to be done for them. So this procedure is to be paid by SHA. So the moment it is paid, the individual will get 50%. The person who approached me saying that the management is aware. So me declining could put my position or my job into something else. So I had to comply.
After the pre-authorization code was sent, the hospital waited for their pot to fill with the fraudulent money.
I'm sure the management was aware, because the money was to come through the hospital account, then it was to be disbursed. It was to be divided amongst
Nataka simu yako.
the share paid to the hospital. And some individuals, especially the second person that approached me, received the money.
This last point reveals the reason why Justice came forward with this information to us. The deal was not honored by the hospital, and they kept the full amount of what was paid by the Social Health Authority. To prove this swing of fraud an extra step further, we asked Justice to take an ultrasound examination. The findings are a damning indication of Sister Mazzoldi's fraudulent activities. The results clearly show that his thyroid gland is intact and normal in sight and size. It further finds that the thyroid is in fact normal. No surgery ever happened or needed to happen. NTV has received evidence that shows that Justice's case is not isolated. In fact, it appears that the money-making outfit of the hospital was a clandestine side project, but they embezzled funds running into millions of shillings on ghost procedures and patients from as far back as when the National Health Insurance Fund was in place to the present-day Social Health Insurance Fund.
We are doing a ward round at the hospital, and when you ask the patient, what's your name, the patient will remove a phone from the pocket, go through the messages, read that messages in order for her or him to tell you his or her name, and they were being given names of other people.
Amos elaborates on an incident where a patient came in and he took them through various tests. Later, he reviewed the patient's file and noticed that the name of the patient was eerily similar to one of his colleagues.
When I questioned about that, I was told, no, this is not the same person. But later on, the sister in charge admitted that we were using the staff members' insurance to assist another person.
This is a video clip recorded undercover where Wycliffe was handling the file of a patient, only to find that it belonged to his colleague, Milka Kwamboka. who registered to undergo a ghost procedure. Once the money was disbursed, she would be given a percentage by the hospital. We reached out to Milka, who says she cannot recall signing up as a patient in order to defraud the then National Health Insurance Fund. The medley of fraud and unexplained maternal deaths taking place at the hospital was reported to the authorities several times by Amos and Wycliffe. Amos specifically reported the fraud happening under the Social Health Authority to them in a 14-minute call he recorded as evidence.
The motivating group or the community to offer medical services using other people's cover.
Yes.
Okay. Thank you, Municipal, for the information. I assure you that you will be taken.
I appreciate it.
Yes, yes. At least we have found the correct name of the facility. So it is known from there. Yes, so Mazol. Okay, Kibro. Thank you for that. Have a good afternoon.
Despite the Social Health Authority representative collecting all the information and recording the name of the hospital in their database and assuring Amos that action would be taken, the authority, led by the CEO, Dr. Masi Mwangangi, did nothing about the situation. Otherwise, we would not be here. The Cabinet Secretary for Health, Aidan Dwale, says that multiple variations of fraud are being carried out by health facilities. I asked him what SHA is doing to detect fraud and if it is really working.
Over a period of time, until May, there was a lot of abuse. For the system, the fraud engine was being built, the ERP was being built. But now, Kenyan health facilities, private, public, and faith-based, who want to do genuine business, now are happy with the system.
So far, the ministry says 13 billion shillings has been recovered in false claims. The ministry has also suspended 1,118 facilities and some 118 files have been submitted to the DCI.
It is very clear now. We have many patients who have given us information, who have written statements with the DCI, with our forensic auditors, and they are protected. And I'm sure the DPP will use them for his case under protection. But I want to ask Kenya, because this is the money we are protecting at SHA, the Ministry of SHA and Ministry. Our taxpayers' money. These are money that is kept to treat patients. So anybody who wants to steal that money is very easy. So I really want to ask Kenyans from all walks of life to make sure that they become the whistleblowers.
While the evil by the hospital management conjured phantom patients, the fraud took on an agreeable symmetry in other areas, specifically tax evasion, which Amos tried to
Akuwe nayo.
report the Kenya Revenue Authority about.
Hivyo tu.
This secret recording shows the members of the management,
Ni rahisi
also
hivyo.
known as the sisters, dishing out cash to one of their employees. This was the main method that the hospital used to evade paying higher statutory deductions, and here's how they did it. In his signed contract, Amos was meant to be paid
Na
36,000 shillings
age
as his net salary, but
limit.
the hospital paid him 30,000 shillings via his bank account and 6,000 shillings in cash without any explanation. When he challenged them, they told him to stop complaining as he had received his salary. This turned up in the KRA system as an underrepresentation of what was being remitted in tax, and they began penalizing Amos thousands of shillings.
I went to the career program, specifically I whistled, and I posted my story about the tax evasion or something like that, and with the evidence of these particulars like petty cash receipts, and I posted my contract because my contract is also part of the evidence as well.
However, the Kenya Revenue Authority ignored his distress call.
I still owe the government a certain amount of money, of which that's not my fault. It's a fault of the facility because they reported my gross income to their head. Yeah. So I am the one who is finding it hard because I still have to pay the tax.
We reached out to KRA to alert them about the matter, but they did not respond. But the problems in this hospital stem much deeper than just a blatant disregard for the law. Many of the patients who came here believed that their medical issues would be handled with an added layer of humanity, considering that it is a faith-based hospital. But even in the subtle nuances, it was easy to tell that this belief was a shot in the dark.
There was this incident where I had been on my off day, so when I came to put on duty, I found two male patients who were admitted at the Melon Ward. And when I was talking to them, after giving them their medications, they told me that they had not eaten since the previous day. I asked them, what is the reason? Why have you not eaten yet you are at the hospital? They told me, we have not been able to raise the hospital bill. So the management said that we cannot eat.
The hospital also barred their relatives from bringing them food. If only this was an isolated incident, but alas, Ken, not his real name, has a similar story. He asked us to conceal his identity out of concerns for his safety, as he's well known in the area. In 2021, he rushed his young daughter to Sisto Mazzoli Hospital after she choked on breast milk, which ended up spilling into her lungs.
Simama anastahili akamuliwe maziwa, akamulie mtoto awekewe, ndio iende isaidie mtoto kama chakula yake. Wakaanza vyakula. Mara ya kwanza akawapea chakula vizuri, siku ya kwanza. Siku ya pili wakaanza kupunguza ile chakula na kumwamuru vibaya.
Ken reckons they reduced the food portions because he had not paid cash upfront, and he asked to use his then NHIF for payment. But relief was in sight for him as his daughter recovered and the day that she was set to be discharged came around.
Siku ya tano sasa atoke mtoto. Sasa wakati nilikuwa nimeenda na NHIF yangu ili angalau nitoe mtoto, akaniambia NHIF haifanyi kazi, na hiyo ndio ilikuwa tegemeo langu. Ukweli wakaniambia NHIF haifanyi kazi. Ile haifanyi kazi, nikawaambia sasa nifanye nini? Waniambia tunataka pesa cash. Sababu yenye nilikuwa kitu around 38,000. 38,000 ilikuwa sawa. Na hiyo ni sawa ilikuwa pesa yenye nilichungia hao wakati wakatoka hospitali. Ndio tufanye nini? Walifikia kama chakula na tumeenda tunasafiriwa moja hivi tatu.
He was forced to resort to desperate measures in order to return back home with his family.
Kabila hizi ni basi. Ukweli wakauza ng'ombe. Kuuza ng'ombe, nikakuja nikalipa hiyo pesa, katoka na mtoto jirani nilikuwa mtoto.
But this is when he knew the plan was sinister.
Kulikuwa nililipa, sikupewa risiti. Nikapiga hesabu sawa, nikawauliza risiti iko sawa, niambia kuna siku kupea mtoto. Kasema kweli asante kwa kumpea mtoto, yaani mtoto ni wa maana kuliko risiti. Kweli nikatoka hapo nikiwa na mauchungu.
In order to interrogate claims of this ring of fraud, we went undercover, and what our team found vividly mirrors what Ken experienced. Our team member first went through triage and observed streams of patients coming into the facility, many of them with their babies. It quickly becomes evident that this is the main focus of the hospital, maternal and postnatal care. For the most part, everything appears to move regularly. That is until the doctor finishes his consultation and lab tests with our team member and refers him to the cashier to make the payment. He requests his lab results and they decline to hand them to him. Later, he pays 500 shillings for the consultation and the lab tests done, but they also decline to give him a receipt for this. We also reached out to Sister Agnes to inform her about our team member's experience at the hospital, which happened when she was a sister in charge.
You want to disturb me of what I've done? He told you, I don't know who is sending you. And I don't know who is engineering you. My number, stop calling me, I have told you.
Then who do I speak to since you're the final leader of the hospital?
Please, can you leave me? I don't call me for anything whatsoever, for God's sake.
The employees are still acting irregularly and I'm trying to notify you.
Call my phone anymore. I have told you, if you want to follow it from the sub-county,
They claim to be a very holistic facility that provide care and holistic services to the patient. But contrary to that, they are using the patients, I believe, to gain money than to help them.
This incident confirms Ken's narration about the hospital refusing to issue him with a receipt after forcing him to pay cash for his sick daughter's treatment.
There's a scenario whereby a mother comes in and this mother has no money or claims the insurance. Now the mother has been told that okay, the insurance will work. Later on, the mother was also told the insurance is not working. Whereas remember, the insurance is working. They wanted to take the money from the mother. They needed cash.
Dr. David Kariuki, the CEO of the Kenya Medical Practitioners Council, says that the behavior by health professionals in the country is held to a higher standard than other professions due to the fine line between life and death and the promise to honor it at the start of every professional's career.
Generally, in medicine, we have a principle we call first do no harm. And with that is why every practitioner at the beginning of their career, they take what we call a Hippocratic oath, an affirmation or commitment that throughout their life they will only do what will be good for the benefit of the people that they treat.
This Hippocratic oath becomes especially important in the next case we will highlight, a tale of a final cry from an expectant mother, a double tragedy, and yet another cover-up by the hospital as we build in the street. Jacqueline Chebet-Ngetich was never meant to die, and we will illustrate why. Indeed, when a mother goes into delivery, the fragility of life casts its dark shadows, as does the contrasting light of a new soul brought into the world after 9 months of a mother's anticipation and love. This is the same energy Jacqueline exuded as her due date drew closer. According to her family, barely into her 30s, Jacqueline had a bubbly spirit about her that was infectious. Faced with the havoc of choice on where to deliver her child, Jacqueline settled on Sister Mazodi Hospital, which implied that principal-led care would be offered. Her mother-in-law asked us to hide her identity for privacy reasons, but agreed to tell us the story of Jacqueline's final day on Earth, 1st April 2023. Just the day before, Jackie, as her family called her, went to Sister Mazodi Hospital for a checkup, but because her due date was near, she packed an overnight bag of clothes and essentials just in case of delivery. This being her third child meant she knew when labor was close, and excitement was brewing in her to complete her trio of young ones with her newborn child.
Usiku daktari alinipigia mimi simu, wewe ni mama Jackie? Niliambia ni mimi. Sasa Jackie nimepata mtoto, lakini huyo mtoto ameaga.
This happened at roughly midnight. Upon hearing the news, Jacqueline's husband rushed to Sister Mazodi Hospital, where he was reportedly told to let his wife rest and instead come and visit her in the morning. This was the first sign that, like Agnes, Jacqueline was about to be denied the care the hospital claimed to serve. Jacqueline's husband went back home and the family jointly went to visit her early the next morning.
Sasa mimi nataka ingia nione Jackie. Sasa nilimwambia mimi nataka wana Jackie, hakuambia mimi chochote. Ndio daktari mwingine akakuja kumwambia mama Jackie ni wewe. Niliambia na huyu ni bwana yake. Niliambia sasa mtulie tu. Niliambia kwa nini? Anasema Jackie hayupo.
Jacqueline was dead. The double tragedy in barely 2 breaths of each other was devastating. But what lingered more were the questions. Jacqueline's child passed on at around 12 a.m., after which her husband rushed to hospital but was blocked from seeing her. Jacqueline then passed away at roughly 3 a.m., yet the hospital did not notify her family. They instead waited for them to come back during visiting hours to inform them.
Sasa nilirudi kuuliza daktari, nini mbaya, ilikuwa nini mbaya? Hata aniambia ni hata sisi tumeshtuka, hata sisi kusituka tu kwa kifo yake. Niliambia na wewe nilisema mtoto wanne wanamwambia nini pamoja na mamake, akanyamaza.
But one of the most disturbing parts of this twisted tale would come when Jacqueline's family discovered that somebody had put her phone on flight mode. But now, 2 years after Jacqueline's mysterious death, we are able to reconstruct what happened on the night in question and how actions by the hospital contributed to this. Jacqueline arrived at 4 p.m. in good health. At roughly 12 a.m., she developed complications and gave birth to a stillborn child. Shortly after, her condition declined. Her symptoms included gasping for air, convulsing, dilated pupils, and bleeding, which by all means necessitated critical and emergency care. A team member on duty called an ambulance from Nakuru PGH to pick Jacqueline up for referral as they realized they could not handle her case. It is here that the management made themselves God and decided Jackie's fate in the dead of the night.
The ambulance from Nakuru County waited for this matter for 1 hour and 30 minutes. The driver was persuading the management that even if she is stable, give us the patient so that we can go because everything is ready to receive this patient. And they refused, the hospital management refused to refer this matter. And after 1 hour, 30 minutes of waiting, the driver received a call from the county again because of the busy schedule of the county. And they instructed him to go to Mokotio to pick another patient.
Jacqueline died some 30 minutes after the ambulance left.
We asked the questions about why did the mother die?
It was this question by Amos and Wycliffe that will set off the next series of events. But before that, we can reveal a video taken undercover that confirms the management's involvement in Jacqueline's death. This is a phone conversation of Sister Redemptor, who made the decision to keep Jacqueline in the hospital as she fought to stay alive. She is speaking with the then Nakuru Sub-County Coordinator. We reached out to officials from Nakuru County to find out whether an audit was launched into her case. They confirmed that one was conducted and reported through the official reporting channels. When we asked what the outcome of the audit was and whether information on it could be found, they did not respond. This is especially strange considering that the Nakuru Sub-County team was aware about the delay in the referral.
Similarly for health facilities, that is why we have a referral mechanism. That if a facility is not able to provide services at a certain level, there's another facility that has what is needed to treat, whether in terms of equipment or in terms of the doctors or specialists and even other professionals that may be required.
That the management was aware that Jackie's case had deteriorated into an emergency, that they refused to refer her, and that they let her bleed to death and gasp for life as an ambulance waited outside to refer her for 1 whole hour and 30 minutes, illustrates how it took almost no effort to be cruel on their part. It also appears that getting away with Jacqueline's case in 2023 made them even bolder with Agnes in 2024, as the curve of evil took an upward trajectory. The Cabinet Secretary for Health, Aidan Duale, states that an analysis of maternal deaths in hospitals are a key point in the ministry's agenda, as the rates are far too high, with 355 deaths per 100,000 live births, according to the 2019 census. However, an assessment on the latest numbers is being conducted, and results are expected by the end of February 2026.
One of the causes is professional negligence. Consultants not to be in some of our hospitals.
referrals not being well communicated. When a mother is bleeding and then she needs to be referred, the other thing is we want to do is to make sure there is proper reporting. Not what the president was insisting. Because now we have the digital platform. And if you look at the law, it's criminal to falsify data, particularly in the health sector.
Another lead on how the hospital handled mothers who are going into their delivery comes from this leaked WhatsApp message from one of the clinical officers who was on night duty. He was complaining about actions by the then sister in charge. He writes, and I quote, "Hii mambo ya oxytocin nimerealize anazificha ndio mama aende CS in the name of prolonged labor." Another states, "Nilishona madhe bila Lipnosine." Lipnosine is an anesthetic to numb and block out nerve signals, typically after a mother has suffered a tear or undergone an episiotomy during birth. The negligence that shrouded rapes. One of the highest heights is a report that one of the nurses who attended Jackie that night was not licensed. She is identified as Sheila Kandie.
It's between me and the body that standing for me, the nursing council.
Actually, no, it's also a public matter because you're the one who is treating patients in the public eye. So those patients need to be aware that you are licensed. It's not between you and NCK alone. It's also about the public because you're treating patients who are part of the public. So why I'm asking...
Be employed in an hospital without it.
So you're confirming that you're licensed?
No, I'm not confirming. I'm just asking you to come to the hospital or let me call first Sister Agnes because I've seen her missed call. Let me call her and ask her.
I'm confused. Why is it difficult for you to confirm if you're licensed or not?
Why are you asking me such questions?
It's a simple question, yes or no. You have a valid idea in the Nursing Council of Kenya? We tried to search for Sheila's name on the Nursing Council of Kenya portal of registered nurses in Kenya, but we did not find her. We also asked NCK if they have any nurse with such a name under the registry, but they said they could not find her. Yet again, the question is why the hospital went to these lengths.
Because of the trend of the hospital, my own understanding it is because they kept this matter for financial gain, because she was using NHIS and they wanted to claim that money.
We reached out to the hospital to verify these claims, but we did not receive any response. Jacqueline's grave rests next to her babies. Her mother-in-law reflects on the last goodbye she bid to Jackie, which she says was different.
Alikuwa mtu wa furaha, hata wakati alienda alicheka. Wakati yeye alienda niliambia, kwani unaenda cheka usiku? Saa 11 anasema maate haina shida, nitarudi saa. Anaenda kweli msichana anaenda kupika huko. Anarudi mtu anakuta kwa maate niliambia sasa nilisahau nini anasema nilikuwa nakuta kumwambia wewe nimeenda.
That Jacqueline could not contend with saying one goodbye and return for a second one lingers on her mind, as does the longing of the 2 children Jacqueline left behind for their mother. Unfortunately, we were not able to speak to Jacqueline's husband in the course of this investigation, as shortly after his wife passed on, he went into mental distress. This video clip is the punctuation of how delays in referring patients at Sisto Mazodi Hospital caused a trail of devastation. This is a mother who brought in her sick child to the hospital. Upon review, the team that received her noticed that the child had a kidney problem and needed to be referred for specialized care, which could not be found at the hospital. The response by the then sister in charge, named Sister Sophia Redemptor, was, and I quote, "If God decides to take a life, then He decides." This is confirmed in this recording where Whitney and Amos confronted her about it.
Sawa.
We reached out to Sister Sophia Redemptor regarding the accusations leveled against her, but she directed us to the Nakuru County audit. The baby was not referred and died that night. Fed up with the spate of gross medical negligence, the absence of good and the presence of evil, Amos and Wycliffe challenged the management about their actions. In particular, they pressed them on why they pretended to refer Agnes's corpse to another facility to avoid liability. They also questioned why medication was being hidden in order to force mothers to undergo cesarean sections and why emergency cases weren't being referred. They also queried why some pages of their contract were missing, yet they were pushed to sign them.
That's when now the management decided that they were going to frustrate us, and that was through changing the terms of our services and our contract. And that's when now the real problems, the bigger problems that the facility started.
Amos and Wycliffe refused to sign the documents by the hospital to alter their terms of service.
It is quite disturbing, even to think about the issues that happened there, given that you find a mother who was okay the evening you are going home, and then the information comes to you that the mother died, and when you ask this question, the facility decide to maneuver.
And then this happened.
They put us at the back of the ambulance. We were 3 of us, and they told us that we were going to the diocese. And you understand that the ambulance, the windows of the ambulances, they are translucent, so you cannot see outside clearly. And so when when the vehicle started moving, the sirens were put on.
While the pair reckon it was a show of intimidation by the hospital, it can also be found to be a violation under Kenya's Traffic Act and the National Transport and Safety Authority guidelines, because an ambulance is legally classified as an emergency vehicle. It can also be found to be a violation under Section 15 of the Occupational Safety and Health Act 2007, which states that a person who willfully interferes with or misuses any means, appliance, convenience, or other thing provided or done in the interest of safety, health, and welfare in pursuance of this act commits an offence and shall on conviction be liable to a fine not exceeding 100,000 shillings or to imprisonment for a term not to